back to the Medigap Show. I'm Holly Cohen, a licensed agent and the founder of MedigapCares.org. I'm here to provide expert guidance to Medicare beneficiaries across the country. In today's video, we'll be discussing Group Medicare Advantage plans compared to original Medicare with a Medigap plan. There's an impact on medication costs and an importance of prioritizing your healthcare needs. So don't forget to like this video if you happen to like it and subscribe to our channel for more informative content. So let's dive in. Sometimes a Group Medicare Advantage plan can be more cost-effective than original Medicare with a Medigap only if you're a retiree who requires expensive brand name medications. Group plans can often negotiate for prices from the collective purchasing power of a larger group, and this helps reduce the costs of these medications. However, it's essential to consider the overall comparison between Group Medicare Advantage plans and original Medicare with a Medigap plan. With original Medicare and a Medigap plan, there are no networks like there are with Medicare Advantage plans. There are no prior authorizations with original Medicare like there are with Medicare Advantage plans. Original Medicare with a Medigap provides freedom of no networks and offers flexibility in choosing your healthcare providers. There is a federal law that ensures Medicare must pay 80% of medically necessary expenses without any questions asked. This prioritizes your healthcare needs over insurance limitations. With Medigap, you have the freedom to see any doctor who accepts your red, white, and blue card, giving you the peace of mind over your healthcare decisions. According to this article by Diane Omdahl, Medicare Advantage retiree plans save employers money, but create issues for retirees. Let's read this article now. Advantage retiree plans save employers money, but create issues for retirees, by Diane Omdahl and posted on Forbes. My father was a lifelong member of the local steamfitters union. When he hung up his green work cap for good in 1982, he enrolled in Medicare Part A, hospital insurance, and Part B, medical insurance, and the retiree plan. He had that coverage until he died. Back in my father's day, signing up for the retiree plan was the way to go. 2/3 of large firms offered health care coverage to retirees in 1988. In 2022, on the other hand, just 13% offered retiree health benefits to Medicare age retirees. There has also been a significant change in the type of retiree coverage employers and unions offer. My father's plan worked very much like the Medigap policies of today. It was a secondary payer with Medicare as primary, covering the costs that Medicare didn't, such as the hospital deductible and 20% Part B coinsurance. And he had his choice of any physicians who saw Medicare patients. But then Medicare Advantage plans appeared. I remember getting a call in 2014 from an unhappy retired Illinois teacher. The teacher's retirement insurance program changed a retiree's option to only a few Medicare Advantage plans. TRIP, TRIP, was one of the first to opt for Advantage retiree plans, and by 2017, 26% of employers had taken that path. Today, half of large employers offering health benefits to Medicare age retirees do it through a contract with a Medicare Advantage plan. Big names making the change recently include IBM, AT&T, and American Airlines flight attendants. Medicare Advantage coverage for New York City's 250,000 retirees was going to start September 1st, but that's on hold after a judge's ruling. A big factor driving this shift, of course, is money. KFF, the Kaiser Family Foundation, Health News notes that employer-sponsored plans receive billions of dollars in federal payments, and the government is paying most of the healthcare costs. New York City alone could save up to $600 million annually by switching to Medicare Advantage for its retirees. Retiree coverage can be a lifelong option, so choose wisely. The plan is in charge. Know that the coverage can change. According to the Department of Labor, unless it is specifically forbidden in the retiree plan documents, companies reserve the right to modify, revoke, suspend, terminate, or change the program at any time. For companies and unions that decide to change to Medicare Advantage plans for retirees, the Centers for Medicare and Medicaid has the statutory authority to waive or modify requirements that hinder the design of, the offering of, or the enrollment in employer union-sponsored Medicare Advantage plans. In other words, CMS, the Center for Medicare and Medicaid, can change the rules to facilitate companies putting these plans into place. One example, a retiree reported his opt-out decision was due in less than 30 days, but he still had not received information to determine whether his physicians would be in network under the new Medicare Advantage options. If there are changes to your retiree plan, proceed carefully. Go beyond the company and plan's promotional information. Scrutinize the summary of benefits and evidence of coverage. Pay attention to costs and benefits. Check out coverage for your medications and whether you can see the same physicians and healthcare providers. Investigate the prior authorization requirements. If you want the new coverage, you'll likely be auto-enrolled and won't have to do anything. However, if you don't want it, things get more complicated, so do some research. Determine whether you can continue with your current plan. Almost 45% of employers offering Medicare Advantage plans do not give retirees that choice. If you can keep it, you'll likely have to pay the full cost. Find out whether you'll lose any other retirement benefits if you opt out. With some of the recent changes, retirees would lose Part B premium reimbursement, subsidies, and/or dependent coverage. Investigate your options to qualify for other Medicare coverage. This can be complicated because it can depend on other factors, such as your zip code, health status, and terms of the contract. Don't miss any deadlines. The sponsor likely has an opt-out date. Miss it and you'll be enrolled automatically. In the last years of my father's life as his power of attorney, I dealt with the retiree plan and never had a complaint or issue. I only wish I had that kind of coverage. But unfortunately, that was then, this is now, and things have changed dramatically for retirees. Companies and unions that opt for Medicare Advantage retiree plans try to make the transition easy. The plan enrolls you, but don't be steered into an unknown direction. If you stay calm and pay attention, it is possible to come up with something that works for you in spite of it all. The article sheds light on the potential cost savings for employers through Medicare Advantage retiree plans, but it highlights the challenges faced by retirees. Considering both the Group Medicare Advantage plans and Original Medicare with Medigap, it's important to evaluate the cost savings, the flexibility, and the prioritization of your healthcare needs. While Group Medicare Advantage plans may offer a few things like the lower cost medications if you're on a very expensive prescription, Original Medicare with Medigap does give you the flexibility to choose any healthcare provider without those network restrictions. And additionally, that federal law, when you're on Original Medicare, ensures the coverage of medically necessary treatment to you, prioritizing your health over the insurance company's limitations when you're on Medicare Advantage. As we wrap up our video today, it's crucial to consider the benefits, limitations, and considerations of Group Medicare Advantage plans and Original Medicare with Medigap. You can find the article that we discussed in my description below, And always feel free to go on our website, schedule an appointment at medigapcares.org with either me or an experienced member of my team. We're more than happy to help you compare your group retiree Medicare Advantage plan versus what it would cost you to have your original Medicare with Medigap. Most Group Advantage retirees still require you to pay for your Part B premium. Don't forget that. Thank you for joining us today on the Medigap Show, where we provide valuable insights and resources to navigate Medicare. If you have any questions or if you need any assistance with your Medicare needs, feel free to reach out. Your healthcare needs to be the priority, and there are resources to help you manage costs effectively. Until next time, take care, stay informed about your healthcare, and be well.